25%, and thus breast cancer is the second leading cause of cancer-related death. So metastatic disease poses quite a few challenges, one of which is diagnostic. We have limited radiologic detection of early spread. Radiologic detection requires focus of over 10 million cells, and at this point it is very likely that the tumors have already spread to distant sites, since even a very small primary tumor can shed hundreds of thousands of cells into the bloodstream. So additionally, there are therapeutic challenges, as systematic agents have limited long-term success. First and foremost, the current chemotherapies target primary tumor growth. This type of therapy would have no effect on disseminated dormant cells. Plus, in certain cases, Taxol, which is known to shrink the primary tumor, has been shown to do so not only by inhibiting replicative tumor cells, but also by scattering tumor cells into the bloodstream. So quickly, this is just a brief review of the metastatic cascade, where initially you have a primary breast tumor that can shed millions of tumor cells into the bloodstream and lymphatics at very early stages, but also throughout metastatic disease. These are called circulating tumor cells, or I might refer to them as CTCs. The CTCs can travel to distant sites where they can arrest until they can finally grow out into clinically detectable macroscopic metastases. Now, CTCs represent a promising strategy for disease monitoring, as high levels of CTCs can predict metastatic potential, chemotherapeutic response, and disease progression. But what if we could target the CTCs to prevent initial and further colonization? And how could this be accomplished if CTCs are inherently drug-resistant due to cell cycle arrest? So one answer is microtentacles. So many of you may not be familiar with these membrane structures, so today microtentacles will be a topic of discussion. Microtentacles are tubulin-based membrane protrusions only observed on detached cells. I will discuss the role for microtentacles in cancer progression and metastasis, and finally how Acetylation, a post-translational modification of tubulin, aids in microtentacle formation, adhesion, and invasive migration. So I mentioned to you, and I will keep mentioning, that when cells break away or shed from the primary tumor, they are released in the bloodstream. Now, many may die due to apoptosis, shear forces, or fragmentation when pushed through small capillaries. However, those that survive are likely apoptotically resistant and cell cycle arrested. And as a reminder, these cells are inherently drug resistant since most chemotherapies target growth. Therefore, inhibiting CTCs becomes a therapeutic challenge. So although these cells are growth arrested by a cell cycle perspective, they are not dormant from a cytoskeletal perspective. So here in this video is a mammary epithelial cell suspended over a surface which it cannot attach to mimic suspended conditions in the vasculature. What I would like to draw your attention to are the long dynamic protrusions from the cell membrane. And as this video plays in the loop, you can see these protrusions wiggling about as if they're reaching out and testing the surface. But of course, at this point, that is just conjecture. So the first cytoskeletal protein that comes to mind when discussing membrane protrusions is actin, which is known to be a major component of filopodia, lambdapodia, and invadapodia. We therefore hypothesize that these protrusions were actin-driven. To test this, we suspended mammary epithelial cells, in this case, MCF-10A cells. And MCF-10A cells do produce a few protrusions upon suspension. Here's one right here. We predicted that treatment of the cells with an actin depolymerizer, Letronculin A, known to inhibit or destroy filopodia and invadapodia, would inhibit these protrusions. However, we were considerably mistaken. Treatment with Letronculin A very much increased the amount and length of these protrusions. We also performed immunofluorescence studies where suspended cells were spun down to cover slips and quickly fixed in hopes of preserving the protrusions. Because remember, they only occur on suspended or detached cells. So our IF studies, and here is an example, have shown that tubulin is localized throughout the structures. While actin is present, it mostly, or most of it, resides at few of the tip's extensions. We have also performed multiple drug studies with other actin depolymerizers, tubulin stabilizers, and destabilizers, and have determined that the driving force behind these protrusions is tubulin. So since tubulin-driven protrusions of the cell membrane on detached cells have never been described, we were able to name these structures, and we call them microtentacles. So we next looked at a panel of breast cancer epithelial cells, and this slide contains a few examples. We've done much more since then. The upper panel contains cells that are considered strongly metastatic, while the bottom panel are non-metastatic cells. We noticed that metastatic cells produce more per cell and longer microtentacles than the non-metastatic cells. These are cells stained with cell mass orange and suspended. Remembering again, microtentacles are protrusions from only detached or suspended cells. The images are then inverted for better visualization of microtentacles. We begin our study with these breast cancer lines, but have also seen microtentacles on suspended prostate cancer cell lines and certain fibroblasts. So initially, one of the questions we received about these protrusions or microtentacles were simply, are they an artifact of cell culture? Over the past few years, we have determined that not to be the case. We have isolated circulating tumor cells from patients' blood, dissociated primary breast tumors, and patient-derived tumor grafts, and have observed microtentacles on the cells in all cases. Here is an example of a circulating tumor cell isolated from patient's blood. It's EBCAM positive and CD44 negative. And we performed suspended immunofluorescence for tubulin, and you can see a significant amount of microtentacles protruding from the cell. So we now know that microtentacles exist, but what do they do and why are they produced? Well, we have determined that microtentacles aid in homotypic as well as heterotypic aggregation. So in this first panel, this is an example of a homotypic aggregation. So these cells are expressing GFP specifically targeted to the outer membrane, which we call GFP membrane. And you can see the dynamic movement of the microtentacles that are not attached to the neighbor cell. The microtentacles, on the other hand, that are attached, and you can sort of see them back here, almost seem to wrap around the neighbor cell. So another question we received about microtentacles is, how do you know these microtentacles are aiding in cell-cell association and not created when cells dissociate from another? So the second panel is an example of an experiment to answer this question. Here we use MDA231 cells. They were separated into two individual wells, and only one well was transfected with the GFP membrane. Cells were both stained with cell mass orange to visualize all cells, then suspended together, and that's the key. They were put together. So here is an example of the two cells associating, because one is GFP tagged from one well, while the other is not, and this is from the other well. So when looking in the red channel only, it is difficult to see the individual microtentacles. However, when the green channel is added, you can see the microtentacles protruding from the cell in all directions and wrapping around the second cell. Next, we have an example of heterotypic association. So this is a confocal image of a live 231 or MDA231 cell expressing GFP membrane, just as it associates with an M-cherry labeled endothelial cell layer. You can see the microtentacles just as the cell settles down, reaching across the monolayer. As the monolayer turns upside down, you can also see these green protrusions from the microtentacles on the 231 cell through the cell monolayer. And as the movie slices back, you can also appreciate that these protrusions have infiltrated between the endothelial cells. So I previously showed you a quick example of tubulin-stained patient CTC, but here is a movie to better appreciate the dynamics of these protrusions, okay? The cells were stained with cell mask after isolation, and the first panel here you're viewing in the fluorescent channel, while the second panel here is in bright field. This is the same field of cells. Okay, as this movie plays in a loop, you can visualize the dynamic nature of these microtentacles coming in and out of focus and wiggling about. And if you look down here at the lower corner of the image, it also looks as though these microtentacles even have the ability to push some cells away. So we now know that microtentacles exist and that they likely aid in cell association. But what is the significance of our finding, and how does any of this relate to metastasis? So, as I mentioned, a primary tumor can shed millions of cells into the bloodstream. And what is the fate of these circulating cells? Well, most die due to apoptosis. Others can die due to fragmentation, being crushed when pushed through the capillaries. But if a cell produces microtentacles, these microtentacles may aid in the cell's initial adhesion or reattachment from the circulation, after which the actin-dependent process of extravasation can occur. Once extravasated, the cell can eventually form a tumor at a secondary site. So, of course, actin is critical for extravasation, but we are proposing a two-step process in where initial adhesion is tubulin dependent. Interestingly, in vivo studies by Korb and colleagues used intravital microscopy to show circulating HT29 colon carcinoma cells adhered to liver capillaries in a tubulin-dependent manner. The in vivo microtubulin-dependent microvascular retention matches that of the cytoskeletal mechanism supporting our microtentacle formation. So, if one could target the microtentacles and reduce them, perhaps we could kill these circulating tumor cells by forcing more to die via fragmentation. Okay, so we've just learned about microtentacles and that cells contain them, and now we want to know, well, how are they produced? So, and I apologize for this confusing slide. I will try and take you through it carefully. So microtentacles, basically to control cell morphology, cells perform a delicate balance of cytoskeletal forces, termed the cellular Tensgriddy model. I can never say that, Tensgriddy model. Expansion of microtubules is counterbalanced by the tension of the actin cytoskeleton to stabilize cell shape. Cytoskeleton aberrations contribute to many characteristics of aggressive tumors, such as increased cell mobility, weakened adhesive contacts, and metastatic dissemination. Here, when a more normal epithelial cell is detached, the microtubules, depicted in green, are pushing outward, expanding against the cell center, or expanding from the cell center, or the microtubule organizing center, are counterbalanced by the contraction of the cortical actin pushing in, which is depicted in red, so the cortical actin cytoskeleton in red. These more normal epithelial cells, upon detachment, then die due to apoptosis or fragmentation, which of course I mentioned. However, a tumor cell, a breast tumor cell, the microtubules may overcome the restrictive force of the actin cortex. So, in other words, the microtubules may become reinforced by some mechanism. And we have determined there are a variety of mechanisms in which these microtubules can become reinforced. Once they are reinforced, the the microtentacles can be produced. So a few examples of reinforced microtubules is the association of microtubule associating protein tau. The more tau you have associated with the microtubule, the more stable the microtubule. Also, there is an unidentified tubulin carboxypeptidase, a TCT, which removes the tyrosine at the carboxy end of tubulin to yield glutubulin. Glutubulin is also a more stable form of tubulin, and that the increase in glutubulin can also increase microtentacles, as well as the association with vimentin, an intermediate filament. That can also strengthen and stabilize your microtubules to produce microtentacles. Also, the microtubule stabilizing drug paclitaxel can actually increase microtentacles and tumor reattachment. So, I mentioned the different ways in which microtubules can be stabilized via associated protein with tau, detyrosination, which would give you glutubulin, and vimentin association. Tubulin acetylation is another post-translational modification of tubulin and a well-known marker of microtubule stabilization. Acetylation occurs on lysine 40, so K40, by the alpha-tubulin acetyltransferase 1, or ATAT1. Okay? It can be reversed by histone deacetylase 6, or HDAC6, and sirtuin-2, or SIRT2. Studies suggest that high HDAC6 levels, so on this end, and low acetyltubulin levels, less acetyltubulin up here, are associated with good prognosis and increased disease-free survival of patients with breast cancer. But the mechanism behind this correlation and the role of this post-translational modification in metastatic breast cancer is unclear. So in the next study, I will present a novel role for alpha-tubulin acetylation in breast cancer. So, although detyrosination of tubulin or glutubulin promotes microtubule stability and microtentacles, our previous studies could not establish a correlative trend between cancer invasiveness and detyrosination of alpha-tubulin. Since circulating tumor cell reattachment is dependent on stable microtubules in vivo, an alternative alpha-tubulin post-translational modification associated with stability was investigated. This project was spearheaded by Dr. Amanda Boggs, who is currently a postdoctoral fellow at the University of Pennsylvania. She began by examining breast cancer cell lines for tubulin acetylation. Her Western blot here shows that metastatic cell lines, the MDA231s, BT549s, and HS578Ts, express higher acetylated tubulin than the non-metastatic lines. Densitometry from 3 independent experiments shows the percent of acetyltubulin within the cells when normalized to total tubulin, and once again, you can see that there's an increase in acetyltubulin in the metastatic lines. In addition to Westerns, she performed immunofluorescence studies to visualize the differences in localization and structure of acetyltubulin as compared to total tubulin in the same cell panel. The non-metastatic lines show low, if any, basal alpha-tubulin acetylation. In contrast, the metastatic lines display robust acetylation of alpha-tubulin with bundling or increased density of acetylated microtubules radiating from the perinuclear region. Okay. So then upon suspension, the breast cancer lines with higher acetylated tubulin produced higher levels of microtentacles. Blinded quantification of microtentacles were performed, and the metastatic cell lines produced the higher microtentacles as compared to the non-metastatic lines. And here are some represented images of the cells. The MCF7s are the non-metastatic, producing few, if any, in this picture microtentacles, while the BT549s, which are more metastatic, you can see all the microtentacle protrusions radiating from the cell membrane. She also performed suspended immunofluorescence studies of the metastatic cell lines to show that acetyltubulin was truly extended throughout the length of the microtentacles, and she did this in both of the two of the metastatic cell lines. So with the increase in tubulin acetylation in metastatic cell lines and the enrichment of this post-translational modification in microtentacles, Dr. Boggs decided to investigate the mechanistic role of acetylation in microtentacle formation. So to do this, she used a point mutation on alpha-tubulin, okay, to determine whether decreased alpha-tubulin acetylation could affect microtentacle formation. So since acetylation occurs on lysine 40 or K40, she used a mutant from previous studies shown that mutating this lysine to arginine would produce an acetylation-resistant tubulin, but that tubulin could still be incorporated into the microtubular polymer. Thus, this mutation should result in less or drop in acetyltubulin. So Dr. Boggs used the metastatic 231 cells and the BT549 cells with high endogenous acetylated tubulin expression and microtentacles, and transiently expressed this mutant, the K40R alpha-tubulin fused to GFP or the wild-type tubulin fused to GFP. And she saw that the Western blots under both attached and suspended conditions in both cell types, that the mutant reduced acetyl levels within the cells expressing that mutant. Once again, she performed immunofluorescence studies and specifically showed that the cells expressing the K40R, the cells that are GFP positive since the K40R is GFP tagged, are also the same cells that show reduced acetyltubulin levels. Okay? So in both cell lines, this is the mutant, and then its corresponding acetyltubulin levels have reduced. As a control, acetyltubulin is not reduced in the cells expressing the wild-type tubulin GFP. Here's one of the cells, and it has similar acetyl levels to its neighbor cells that is not transfected. So since the K40R significantly reduced acetyl microtubules, the impact of this reduction on microtentacles was determined. This slide shows the MD231s and the BT549 cells expressing the non-acetylatable K40R cells produce less microtentacles than their wild-type expressing counterparts. The microtentacle frequency was reduced by more than 45% in the MD231s and 62% in the BT549s when compared to their controls. So because reducing acetylation of alpha-tubulin decreased microtentacle formation and frequency in high acetylated metastatic breast cancer cell lines, Dr. Boggs performed the reverse experiment to determine whether the acetylation in non-metastatic lines would promote microtentacles. To do this, she overexpressed the alpha-TAT1, the enzyme shown specifically to acetylate alpha-tubulin on lysine 40. And this overexpression should produce an increase in acetylation of tubulin. Here, the MCF7 cells were chosen to overexpress the alpha-TAT because they have low endogenous levels of acetylation and microtentacle frequency. So, overexpression of the alpha-TAT fused to GFP, shown right here, caused a robust acetylation of alpha-tubulin throughout the cytoplasm, where the GFP control transfected cells were unaffected. Concurrently, immunoblots showed that the alpha-TAT overexpression greatly increased the endogenous acetylation of tubulin in both attached as well as suspended cells. So next she suspended the cells, and the suspended alpha-TAT GFP or GFP control expressing MCF7 cells were, like I said, suspended and showed the alpha-TAT expressing cells showed a significant increase in microtentacle frequency by approximately twofold. And because of the significant difference in microtentacle frequency, she could perform the suspended IF, and that revealed that the acetylated alpha-tubulin did indeed extend within the microtentacles of the alpha-TAT overexpressing cells, but not the GFP control cells. Now, the GFP control cells don't even form tentacles or microtentacles, so that's kind of a moot point. But the point here is that the overexpressing alpha-TAT increased the microtentacle production, as well as the acetylated tubulin is within the microtentacles. Next, microtentacle function was evaluated by the ability of the detached cells to reattach, modeling one of the early steps in circulating tumor cell retention. To assess how the reduction of acetyltubulin affects the reattachment of the metastatic cell lines, again, the MDA231s and BT549 cells expressing the K40R mutant were analyzed using the ACEA xCELLigence real-time impedance system. The K40R alpha-tubulin mutant reattachment was significantly decreased in both cell lines as compared to the control. In complementary experiments, increasing the acetyltubulin by overexpressing alpha-TAT1 in the low acetylated and non-metastatic MCF7 cells showed that the increase in acetylation significantly increases reattachment. Since reattachment is only one step in the metastatic cascade that could promote disseminated disease progression, Dr. Boggs continued to investigate the role of acetylated tubulin in another metastatic process dependent on cytoskeletal coordination. So she chose to look at migration. Again, the MDA231 cells and the BT549 cells stably expressing the K40R mutant were subject to real-time migration system. The assay, which Lena also described, is similar to a Boyden chamber where the cells are seated in the serum-free conditions in the top well and allowed to chemotax to an attractant in the lower chamber. Over the 24-hour period, both stable cell lines expressing the K40R migrated significantly less than their wild-type tubulin expressing control counterparts. In addition to the real-time measurements, shown are representative images of the underside of the upper chamber stained after 24 hours to visualize the cells which have migrated. You can see the differences. However, the MCF7 cells, which transiently overexpressed alpha-TAT GFP, showed no significant decrease in chemotaxis in 24 hours. So this data supports a model in which transient increase in acetyltubulin is not sufficient to promote migration in non-metastatic cell lines, but acetyltubulin may be necessary for chemotaxis of the more motile and metastatic breast cancer cells. So to extend the in vitro findings that tubulin acetylation promotes microtentacle generation, tumor cell reattachment, and affects migration, tumor acetylation was examined in patient tumor samples. Tumor microarrays from primary lesions and matched lymphatic metastasis of 144 patients with breast cancer was examined to determine whether changes in tubulin acetylation status from primary to metastasis could reflect a selective advantage for primary tumor cells during the metastatic process. Immunohistochemistry for acetylated tubulin was performed and samples were blindly scored by a board-certified pathologist. So here are some examples, representative images from the IHC. Horizontal pairing represents the primary tumor and the matched lymphatic metastasis from the same patient. And what I would like you to see is that there is an increase from primary to matched mets of the staining for alpha-acetylated tubulin. And there was a statistically significant increase in acetylated alpha-tubulin score from primary to matched metastasis in 30% of the patients. And approximately 12% of the patients already had high acetyltubulin levels in their primary tumor, maintained similar high levels in their metastasis. So overall, we determined that only 17% of the patients decreased in acetyl intensity as compared to the 41 patients who increased or remained strongly positive from primary tumor to matched lymph node metastasis. So this tissue microarray results demonstrate that acetylated tubulin is clinically relevant as a clinical relevant modification that increases in breast cancer metastasis. So given the strong correlation between high acetylation of tubulin and metastatic breast cancer lines and an increase in patient metastasis, Dr. Boggs investigated the possibility that acetylation may be associated with a more aggressive breast cancer subtype. So when so in panel A here, this is a large patient cohort of 392 patients, was separated by subgroup. So there's the basal-like breast cancer, HER2 expressing breast cancer, luminal A or luminal B. More than 72% of the patients diagnosed with basal-like breast cancer had a high acetyltubulin in their primary tumor. And this basal-like breast cancer is a very aggressive, very difficult to treat breast cancer. While in the HER2-expressing breast cancers, only 25% of these patients had a high acetylation in their primary tumor. And the luminal subtypes showed a relatively even distribution between high and low acetylation intensity within the patient primary tumors. However, in panel B here, the basal-like tumors had an average acetyl alpha-tubulin intensity around 1.5 times higher than that of the HER2, luminal A, or luminal B subtypes. And finally, C and D are Kaplan-Meier analysis from another 270 patient cohort where the patients in the highest acetylation category are approximately 3 times more likely to be at risk not only for disease progression in C, but also death compared to the subjects with the lowest level of the marker. So the conclusions from this most recent study are as follows. Significant association between breast cancer cell lines and high acetylation of alpha-tubulin extend throughout the lengths of microtentacles. Mutation in the specific lysine, lysine 40, in alpha-tubulin, as well as enzymatic modulation of this post-translational modification has a significant impact of microtentacle frequency and cancer cell attachment. Alpha-tubulin is necessary for migration. Matched primary and metastatic tissue arrays show tubulin acetylation is maintained or increased in nodal metastasis. A large proteomic study, it's actually 392 patients, linked high tubulin acetylation to the aggressive basal-like subtype, and a trend of increased risk of disease progression and death was determined when alpha-tubulin is high in a patient's primary tumor. And I would also like to say, leave with the following thought, that a major challenge in targeting metastasis is that the tumor cells can leave the primary site and begin metastatic progression before cancer is clinically detected. Although circulating tumor cells can enter the bloodstream before diagnosis, early steps in the metastatic cascade are still reasonable targets for therapeutic intervention. Ideally, targeted therapy against dissemination, reattachment, or invasion could be successfully combined with existing cancer treatments to control or prevent metastatic disease. And with that, I would like to reference and thank people who are in my lab and my very amazing mentor, Dr. Stuart Martin. The naming and the determination of microtentacles actually came out of his lab, our collaborators at other institutions, and our funding sources. And lastly, just to promote ACEA's xCELLigence technology, we use their machine for our assays in almost every single publication that comes out of our lab. So we've used their technology in this list of our most recent publications. So with that, I would like to say thank you, and I'll take any questions.